psychological evaluations needed for a GD to get a GD certificate?
Yeah. So usually the GD certificate procedure, if we talk about it country-wise, I think there is still the lack of a standardized protocol for it. So different psychologists and different mental health professionals would suggest different sorts of procedures. But like there are certain routine assessments which I can just talk about. Say, for instance, if you're going to a psychologist, the psychologist is going to see if you have any mental health conditions that might interfere with your daily functioning and might compound your GD, in the sense that the dysphoria that you have right now might be exacerbated by these conditions. Like if you have very high clinical depression, or if you have very high anxiety, if you have severe substance use that can be unhelpful, if you have psychotic symptoms, like you are experiencing hallucinations, like seeing something that is not there in the environment, or hearing voices or stuff like that. But once again, my purpose of saying this is to sort of see that you are at a place where your distress related to gender dysphoria is significantly separable from the other mental health issues that you might be having. Though I think this is complex also, because these are intertwined in a network, right? And therefore, the goal of the psychologist to evaluate you is not to withhold you from transitioning, but to facilitate that and to provide you optimal care for whatever mental health distress that you might have at present, so that you can carry this process forward. And therefore, there is some like mental health condition assessment with respect to depression, anxiety, like I said, severe substance use, psychotic symptoms. These are the things that are usually ruled out. There is often a personality assessment. Some trans persons are also given projective tests, like stories they have to tell about cards, and from there their gender identity is inferred. But in my opinion, I do think that these procedures are often not as important. What is very important is to collect a detailed history of the person and to check in with how the person feels. And something that I have seen being severely absent from clinics in India, but which could be easily incorporated, is the use of standardized scales for gender dysphoria, which is available internationally. There are several validated standardized scales which are available for gender dysphoria. I think they should be routinely used by clinicians, because the main benefit of these scales is you can ask the questions which have been standardized on transgender individuals themselves. And then from those questions, you can document it in terms of a score, that the person has this much of distress. And on the basis of that, you can definitively say that therefore this person is experiencing significant dysphoria on the basis of the challenges that are coming with a non-normative gender identity, right? But this does not happen. A lot of professionals don't know about these scales, and that is a sorry reality. But I think they should be a part of evaluation.